Last week at McMaster University and St. Joseph's Health System's Innovation Sprint, the teams of undergraduate students, graduate students, and alumni met a patient living with COPD.
The shortness of breath, especially on exertion, is one of the hardest things to manage. You feel like you've got a weight on your chest. It's difficult for you to move around. It becomes really strenuous. Your breathing rate is really high, and you have a bit of a tough time.
Students also learned about the current model of the St. Joseph's Health System's Integrated Comprehensive Care Program.
When we started back in 2012, it was all around innovation and breaking the rules and putting patient at the center of care. And I think we're always looking for perspectives that give us more value and allow us to improve on the model. So I think having the experience and questions from the students and bringing their different perspective can only help to improve the ICC model going forward.
This week, students presented their problem pitches to the stakeholders, which outlined key problems, underlying rationale, and the potential for innovation within the ICC program.
So we want to kind of focus on the structure of the model in changing it so that the patient is prepared for what their life is going to look like even once they've been discharged from the model.
Within the ICC program, we see two opportunities to innovate. Broadly categorized, the first one would be to bridge the gap between PCP and the ICC, and the second would be to allow patients to have more access to their own health records.
How the information about prescriptions for patients is collected and distributed amongst caregivers and the patients.
Right now, we particularly looked at how ICC can integrate other health professionals, how the software platform that ICC currently has, such as Procure and Epic, can be integrated. We've also looked at how in a home care setting, patients can be monitored and can be tracked in terms of their health conditions.
The biggest opportunity is what it can bring to the future generations, and that's really kind of relating back to what my group wants to do. We want to make something, we want to innovate something, we want to put something out there that the current generation can start to use, kind of test the waters out there, and really, really cater it for 10 years from now. So I think I see innovation in the future of the model by fixing the current loopholes that exist.
Next week, these students will use design thinking methodologies to prototype their ideas and develop an impactful pitch for a panel of judges.
I was surprised about how much, first of all, they were genuinely interested in COPD, and they were genuinely interested in looking at solutions. They had a lot of background knowledge that I didn't expect they would have. I mean, they were really knowledgeable in the questions they asked and enthusiastic.
What innovative ideas will the students come up with? Which ones will rise to win the grand prize of $1,000 with their impactful pitch? Follow along and learn with the students on Facebook, Instagram, and Twitter with the hashtag InnovationSprint. Learn more at stjos.ca.